final session of the day. So I'm really looking forward to this session, and I am absolutely delighted to be joined by Palvi and Jasmeet. These two fabulous ladies were absolutely pivotal, as well as my predecessor, Adam, in producing the people plan for the Institute of Health and Social Care Management. And today is really looking at the next steps for the people plan. What would that look like? And what are the areas that we should be really focusing on? So we've got a couple of headings, a few headings that we're just going to have a discussion around, and it would be good to get your thoughts as well. So do you want to introduce yourselves first of all? So I'll go over to Palvi first of all.
Sure, thank you so much. My name is Palvi Dodhia, and I'm the co-founder of a company called Serene Care with my partner Jake. We own 4 care homes in the Midlands. 3 are residential care and 1 is a nursing home. We are very fortunate. We've done a lot of national public speaking. We've won a number of awards now, and I think we've been quite lucky to get the opportunity to voice our support for the sector.
Yeah, absolutely. Thank you. Over to you, Jasmeet.
Hi everyone. So sorry about the slight connection issues earlier, but I'm very excited to be here. So I am currently a consultant for social care, predominantly specialising in how to support care providers in their journey to know the sustainability perspective. But I was associate director for RCH Care Homes for 6 years. They are a medium-sized service in the southeast and east of England, predominantly specialising in residents living with dementia. But we also have a supported living service for young adults with learning disabilities and a rehabilitation unit for people with acquired brain injuries. Palvi and I have been working on the people plan for the last couple of years. It's actually how we became friends, and I think there's so many great things about the sector, and the IHSCM has been great in helping to promote that, and I'm really happy to help support that as well.
Yeah, she's my best friend now, and that will be from the people plan.
Exactly.
Well, I'm so glad.
There's no other positives come from the people plan. The fact that we're now best friends has.
Well, I'd like it to continue, and that there will be. I mean, it's absolutely fantastic that you're now super best friends, but what I would love is that for something really tangible to come out from that. So yes, so it was really, obviously you have real in-depth knowledge as to what the people actually want and need, as far as what we need, because we know that the workforce needs to grow quite considerably. We need to make sure that we are going to attract people to the sector as much as possible. So I think there is lots of things we can do. So it's really looking at what those elements are. And I think the first question really is to talk about how do you create a really great employer brand that people will want to join. So over to you, Palvi. Yeah, do you want to start?
Yeah, that's fine. So as I mentioned, we've got 4 homes, and prior to this, we were actually in investment banking. My husband and I, we weren't actually in social care. So for us, we've managed to have the benefits of learning from other sectors, which have got really, really strong brands. When I first started working on the people plan with Jazz, I think I had 1 care home, and I was just a very loud voice with 1 care home. And I didn't understand why lots of medium and large operators could have a massive say, and small providers like myself at the time just could not raise their voice. And I was getting very frustrated, because as a small operator, we're very hands-on. We can't hire as many staff as other people when you've got a larger organization. So I was on the ground a lot, helping and supporting my 1 service, and then growing to 2, etc., etc. So I think I had a bit more of a hands-on effect of what we needed in the home. So I think I was just a bit of a louder provider. This all tied in during the pandemic as well, so that all hands were on deck as well during that period. And what I found was it was working collaboratively with other people. I got lucky that Jazz and I met the way we did, but then I got the benefits of having a mentor from RCH, which was a 10-home operator, whereas I was a 1-home operator. And I think it's through collaboration with really good other strong brands I've been able to build my own brand. Because what I had the benefit of doing was looking at other people that are my role models, and that's where Jazz was and is, of course, and seeing what do they do well, and then trying to quite frankly emulate it, because that's how we grow and we can take the best from other people. And as I've been looking around the sector, attending lots of events, the Care Show, and all the big ones that we're aware of, you get to meet a lot of people, and when you see them, you learn so much about what other companies are doing. So as a small operator, I had that network, and I think it expanded a lot during the pandemic, where we were all on teams, so there wasn't the boundaries of how do we go and meet each other in person, because I'm a working mum as well. So at 4 o'clock I'll be dashing off to pick my kids up like the other parents, so I can't always attend events. But the fact is, teams has made it easier for me to have those connections where I can speak to bigger operators, larger operators, and other small operators and say, what do you do well and how do we make it happen? And I think as a small operator, I don't have 15 people to check. I can just decide, and that makes a massive difference, because our ethos is we just want to run a very good company that helps people. That's it. It's not, there's no big fancy other thing we want to do. We've come into social care to make a difference. And if, and we're lucky because we can then reach out to people like Jazz and say, right, how does your company do it? This is what I'm struggling with. I don't have as much money in my company because I had 1 home, 2 homes, and I'm now getting to a point that we've got a little bit more capacity with resources and stuff. But when it was just 1 or 2, it's very hard, and I was leveraging my network a lot.
Wow, that's amazing. And I'm sort of, because you were saying about COVID, do you think it made it easier for you to network and ask those because would you have had the same opportunity if COVID, would people have been as responsive for those questions?
I think at that point we were all quite desperate to help each other. There was none of this boundaries of, oh, it's my company, I'm not going to talk to you and they're going to steal my ideas. At that point, we realized this was not a first world problem. We were all providers struggling. We had very little guidance. Things were happening to our residents and our staff, and we just needed to collaborate and see how we could help each other, share practices. And that's just built this bond amongst a number of people in the sector, where we've just had each other's back for many, many years now. That was 3-4 years ago now, and that has carried over. So even if things have changed now, we're back to the live events and we can't all attend them, that relationship's still there, because during the tough times when we needed each other, we all had each other's back. And I think that's, if there's been any benefit from the pandemic, and that's very, very few, that was the only one I had, because for me, my son was 6 months at the time, my daughter was 4 years at the time of the pandemic. It wasn't that I was going to be going to some social drinks. I was just a mom working from home, trying to run my business, whilst I was trying to homeschool my children and deal with the other one's potty training. So again, it was a very different period. But I've taken up enough space. Jazz, jump in.
Yeah, I do, like I was saying, I think that there has been a real shift in the sector from competition pre-pandemic to collaboration more so now. And I think one of the best parts of being in the social care sector is that you can leverage the knowledge and expertise of people from all over the sector and all over the country. And because you've got virtual arrangements, like whether it's in Teams, etc., you are able to learn from people in Cornwall, even if you're based in Newcastle, for example. But going back to your earlier question of building an employer brand, your brand essentially at the end of the day is going to be what people say and think about you when you're not in the room or when they're behind your back effectively. And your brand is going to be first of every touch point. It's easy to think your brand is your logo or your website, but actually your brand is what do people think and feel about you when they have finished interacting with you. Now that could be a supplier who's spoke to your receptionist when they're dropping off deliveries. It could be how families think about you when they talk about the care service that they've received from your teams. It could be what potential job applicants will say when they come away from an interview. So your brand, there's a stat which says that for someone's brand to be embedded in someone's memory, they need about 8 to 13 touch points. So those 8 to 13 touch points could be virtual ones, it could be physical ones, it could be a poster, an advert, it could be a whole host of things. So I think, like, in terms of building an employer brand, the most important thing is how are your teams talking about yourself? Like, are they coming back and talking to their friends and family and saying, oh, I had such a great day, I really love the work that I'm doing, I have a great manager? Are they coming back and saying, you know what, I really hate working here, I never feel like I'm heard and never feel like I'm listened to? Because the NHS has a universal brand. Like whether you live in Scotland or in London, everyone knows the NHS and everyone loves the NHS, but social care is very different. We are a very fragmented sector, and we are much smaller providers who are in the hearts of our local communities. And so if you want people to, where people will go and apply in terms of like recruitment is they'll go apply to places that they know. And they might not know you from an advert, but they will know you from what your current teams are saying about you to their friends and family. And then it's through word of mouth.
Absolutely.
I think that word of mouth is the most important thing, because right now it is so important what my staff are saying to professionals, visitors that come in the building, the way they answer the phone, every single one of those things will leave a taste about how professional we are or we're not. Now, what's interesting is, whilst my brand is Serene Care, we've got lots of different SPVs. We don't actually have it Serene Care. However, every single person will still call my care homes a Serene Care branded home, because that's just the way they know it. They associated it, they've seen it on social media, they've seen the websites, etc. So even if it is called something else, they'll still go with Serene Care because that's the brand they believe in. It's the one that they've invested in, and it's the one that we're building out. But for us, I think what I've struggled with is, as I'm growing, I know I can't do everything. So I have to train staff to do things in the way I would like it done. I would also found that it's reverse. I find that I've hired a lot of people that are a lot smarter than me, and I'm learning so much from them. And I wonder how I got away with it for so long, because they're just brilliant, they're intelligent, they do things in a way that I wonder, what was I thinking? Why did I think this was an okay way of doing it? They professionalized my services in a way that I thought I had, but I hadn't. So again, it's about the people you surround yourself in your team. And I always say you should always hire people smarter than you, because otherwise my company will be limited just by my and my partner's intelligence. Whereas actually, if I hire someone for 6 months, I'm smarter because I've learned from those people, and those are things I'm going to carry forward with my company. So again, I find it very interesting when employees are threatened by hiring people that aren't pushing back, aren't, pushing them to be better employers.
Yeah, I'm not. That's absolutely super. Super. Go on, Jasmine.
Oh, sorry. I didn't mean to interrupt. I was just going to say there's a phrase that is quite popular, which is the culture that you tolerate in your services is the culture that you promote. So if you are tolerating bullying or like bad behavior of some sort, poor leadership, that is what you are effectively promoting as the culture that exists and that you want to keep. And if you don't take active effort to change that, that is what you're going to be known for. And it comes down to like what your team and what your company values are. Like within social care in particular, values-based recruitment is such an important aspect, because I personally a strong believer of the fact that you can train someone in skills and core competencies, but you cannot train values like kindness, compassion, empathy, etc. And so at RCH, one of the things that we did when we overhauled our recruitment process 2 years ago is that we stopped asking for CVs, because on the CV, you're not going to know, is someone kind? Are they a good team? Do they have empathy, and do they listen well? Those are traits that you will only really engage in, or like you'll only really see once you speak to them. So if they want to send us a CV, they're obviously more than welcome to. And I appreciate this is not for every single role, but for the vast majority of our roles, we have not asked for CVs. And
we don't do CVs either. They're irrelevant. It's a waste of time, and I don't like. Who cares? I know as part of due diligence and HR background checks, they'll need to do the employment and all of that.
But you can do that further. You can do that further in the recruitment process. You don't at the application stage, because at the application stage, bear in mind, like we are an attention economy. Most people, when they're scrolling online, they're skipping through things after 2-3 seconds, and if you don't grab their attention straight away, gone. So if you're then asking for a CV and they're applying on their phone, most people do generally now tend to apply on their phones if they're applying for online roles, online adverts. Their CV is probably on their laptop. They don't have a copy of that on their phone. They're going to go, oh, I'll come back to it, and they'll probably forget about you, and then you've possibly missed out on a great candidate. So I think it's more important, especially in the early recruitment stage, is to think about at that point in time, they are not selling themselves to you. That comes further on along in the process around like the interview stage. at the early, like, job advert section, you are selling yourself to them. So why should they come work for you? I think one of my pet peeves within the social care sector, and we saw this fed through in when we did the people plan consultation as well, is that the job adverts that you see in social care are like, you need to do this, you must be able to X, Y, Z. Why would, if just think about it, why would anyone want to come work for you if you're being dictatorial like that? Instead, talk about what do they gain out of it? What skills and experience will they learn? What are the benefits that they're going to receive? And then, yes, you can talk about the requirements that you need, but it needs to be very much about you sell yourself first and you sell the sector first. And it's their turn to sell themselves further along the process.
That's absolute music to my ears. So that's absolutely wonderful, and it works. That nobody here, it works. That sort of recruitment, I am sure, if we could produce some stats on it, is far more successful than those with lots of heavy words that are not inspiring, because we are actually trying to inspire people to come and work in care, because we know it's an absolutely amazing profession.
But we don't actually have agency in our homes because of the style we have, because of the same thing. We use the style that Jasmeet's mentioned. We don't worry about the CVs. We just get people in, especially, we're going to talk about overseas recruitment. We get a lot of candidates that are from another country. They may not have naturally done it in the same way, but they've got CVs that show them that they've actually done physics degrees back in India, or, very different things. So again, we just need to meet the candidate and then take it from there and see if you can gel together and see if this is the right fit. Because as Jazz mentioned, we can teach anything in terms of competencies. We can put people on the right training. We can put them on the MVQs. With the right attitude, you can learn anything.
Absolutely. And values-based recruitment, I always say your values need to run like a golden thread through the organization. So it's right from the people who are going to apply for a role, to the people using the services, to the senior leadership team, to the suppliers. People understand who you are and how you operate, but it just really gives you the moral compass that you need in order to run your business effectively. And that's the sweet spot, isn't it? It's really understanding the value, and from a strategic perspective, what values can actually add to it.
Yeah, and as individual care providers, if you have 10 or 15 core values, no one's going to remember that. They need to be easy, quick, digestible, and something that you can say off the top of your head. So at maximum, you should have 3 to 5. And those you can obviously want to have lots of values, but what are your 3 to 5 key core ones? Think about those, and think about how, exactly as you said, like, you bring them into every stage of the service. And from a workforce perspective, that is from how do you bring that across in your job application stage, into your inductions, into your personal development plans and appraisals, into even exit interviews. This is a tip that I heard from someone else, but I actually think it's a really good one, is don't just do exit interviews, also do stay interviews with your current teams. Ask them, what is it that you're doing well that's making them want to currently continue to stay? And what would it take what would need to change for them to suddenly decide, or maybe not suddenly, maybe over time decide that they no longer want to work with you or for you. So that's definitely one thing. And also, from going to the beginning side of it, the recruitment side, is you don't need to have people who have worked in care before to come work in social care, like to continue to work in social care. We absolutely should be attracting people from other sectors. At RCH, we ran sector teams, this is probably going back 2 years, and we asked them a question: which industry did you work in before you worked in social care, whether RCH was your first role in social care or not? And the results were, like, from literally every industry. We had teachers, people working in retail, hospitality, law, engineering, finance, data analysis, construction, vets. I think the only thing that we didn't have was someone working in aviation, and that's only because I didn't think to include it as part of the survey options. So we have a real breadth of expertise. And then one of the things that we did, I'm really proud of, is we created a video asking our teams, why did you choose to come work in social care, having worked in whichever other industry that you have? And it was like, it's social. There's no point someone from a senior leadership team perspective saying, this is what you should do, and this is why Like, you need to hear from the people who are experiencing it themselves. And so having that, like, that physical social proof it adds so much credibility to what you're trying to do. And you can do simple things like, if you're asking someone, have they got any prior experience in care? Most people are going to assume, do you have paid experience? So what we do on our careers guide is we say prior experience can be voluntary, it can be looking after a loved one, it could be anything really. It doesn't have to have been paid work. And just by providing that reassurance at the beginning, it actually opens people's minds and go, oh, you know what, I do have experience in this, or I do really enjoy this part of, the volunteer work that I've done before, and I'd like to continue that forward. And so again, it's just like when we talk about attracting people from outside the sector into social care, there are simple ways that you can talk about it and do it. And it doesn't require a huge cost. It's just a change in language.
And I think what you're saying there, because you've got so many people from different sectors, you can then start to really create your career pathways. From if you know who you've got within your team and the skills that they have that they've had prior to coming in to work for you within a social care setting, that I'm sure makes a really big difference. So you think, oh, right, they've got that skill, what that could translate into this role. Those skills could be used there. Is that something that you've done or consciously looked at?
Yeah, absolutely. I mean, so much of it is about transferable skills, but not just from outside the sector. It's also, what are the transferable skills within? So, for example, we have members of our teams at RCH who they don't want to move to management positions. They really enjoy the frontline aspect of care, or like all of the engagement that they have with residents. They don't really want to take time away from that. And so when we think about career paths, we think about training, we go, okay, well, how can we still provide them with development of some sort? And so sometimes people, they will want to move horizontally. So for example, move from a care role into a lifestyle team, want to move from the catering team into the care team. And we provide that kind of support. I think a lot of other care providers do that and should continue to do that. But it's also, there's a podcast called Squiggly Careers, which I think is great for just such like really practical advice and tips. Palvi is laughing because I always have a podcast that I listen to or that I'm giving advice about. But Squiggly Careers is great because it looks at it talks about something called a skills safari. So what are the skills that your team have? I think outside of the box. Like, so for example, if you've got someone who loves writing, maybe ask them to write a blog for your careers website. Right? If you have someone who really loves creating TikToks, create TikToks of some of the really great activities and events that you're doing with your residents. And then they can be part of that. And it doesn't need to be, you're changing your entire role, you're changing your entire job description. It is tapping into the areas of interest and skills that they already have and or that they want to develop. Again, another tip that I had, and I wish I could take credit for this, is if you have people who beyond the mandatory training, what other skills do they want to learn? And if they don't want to learn certain ones which are like social care specific, how can you use your training budget in innovative ways to support them with their personal development? So this is again a story that I've heard where they used their training budget to help provide driving lessons for a member of the team who really wanted to learn how to drive but had completed all of let's call them the social care specific courses or areas of interest. And that was a way that they helped me keep that member of the team. Instead of them getting disengaged and going elsewhere, they were like, okay, I'm feeling personally supported and I'm learning, I'm still continuing to learn. Sorry, I feel like I'm talking a lot. Probably your turn.
Amazing.
I enjoyed it. No, but actually that's very interesting, which I said, because recently we've had someone from our domestic team help with maintenance, and it's something that she just loves painting. So she was like, let me paint the doors. And we were like, are you sure? Yes. And she's done an amazing job. But that's the thing. Sometimes we don't see the talent and skills we've got within our own business, within our own staff. And sometimes you just need to ask them for help. So now I've stopped having that preconception of, oh, this person will only want to do this job. I've moved away from that. We just chuck things out. We stop having these things in our own brain where we say, oh, it's a man's role, it's a female's role. There's none of that. We very much think, what do you guys want to do? And then we find that there's a lot of female staff that are very digitally savvy, and then there's a lot of men staff that are really good at other things. And we're just like, you know what, all these preconceptions we originally had are gone. Now, my head, I genuinely think you can all do anything. You just need to first point out that there's these opportunities. But as a team, they become stronger for it because actually they're not bored, they're not doing the same thing every single day. For us, it's really good because they're so much more invested in the business because they are learning a new skill, they're sharing something, they're showing themselves to be good in other things. And for us, we always just think, wow, this person's really amazing. We can see they've gone above and beyond because they have shared something that they can perhaps do from their personal life. Like Jasmeet said, some people are very good with technology and can make videos for us. And we think, well, that's really, that's something that people just do as a hobby, not realizing that would really help your employer.
Yeah. And you know, we need to enjoy what we do. You know, you don't, when you go to work, you want to enjoy it and you want to feel like you're part of something. And when you engage them in that way, and I'm sure you're doing that, you know, during one-to-ones, during appraisal processes, where you're just opening up those open questions and saying, what do you want to do?
I think that's something that I wish I realized before because like I said, social care wasn't my first career. So I wish I knew how amazing social care is. Yes, it's a difficult sector. Yes, there's a lot of regulation. Yes, we all know what's happening right now with the regulator. You know, there's so much happening. But if we take it down to the bare basics of we get to help people every single day, we get to help make a difference every single day by freeing up the hospitals and taking people into our service. We're helping the wider sector as well. We're helping the extended family as well, because actually they're not able to look after their mom, their dad, their granddad anymore, or their husbands, or however it be. We're helping the wider country demographic. And I think that is such an amazing thing. If you sit down and actually realize what our teams are doing every single day without really realizing you're not just helping one person, you're actually helping the whole village by helping that one person.
Yeah, because it's quite often, yeah, definitely interlinking to the families as well, because you make a difference in that person's life, you're definitely making a difference to the families as well.
Exactly.
Yeah, definitely.
And also, social care isn't just frontline care. Like, I think there's this misconception, and similar to Palvi, like my background actually is in finance. So I moved into social care from a different trajectory as well. But there are so many different career pathways that are available or that we should be promoting. So if someone loves marketing, why can't they come and work in marketing and social care? Same for legal, same for HR, same for, you know, tech, maintenance. There's the career pathways aren't just frontline care, but frontline care is also so important, and we should be talking about it more. And I think it's so easy as a sector to complain about, you know, this is going wrong or this is an issue, and we just need to talk more about the positive aspects. And one of the things that we were really keen to do when we were doing the people plan is to not focus on the status quo, but to actually look at what are the examples of good and outstanding practice, and what are the positive aspects of social care, and promote that. So if you haven't already had a chance to read the people plan, either version, there's two white papers we've written. Feel free to go.
Well, yes, please do. I know we will share them after this, but I've read through them, and then I've had a look, and I've actually put them in the sort of proposal that I'm doing. You know, on the elements that we can control. So what parts of the people plan, the recommendations, what can we influence? Because there's certain things that we can't influence. We can't influence what governments are doing, but there are absolutely things that we can control. And what would that look like? You know, what would that reality be like?
I think one of the big things is the perception of care. That was one of the things that was really frustrating for me and Jazz. And I'm going to steal Jazz's story because Jazz says it to me all the time, was why don't we have a really positive show about social care? We have the Grey's Anatomy. Jazz, you always say this to me. We have, why do we have Panorama as our show?
Yes,
that's the thing, like,
that is so true.
Why do we not have, you know, the Grey's Anatomy, the ER, the sexy version of social care? We only get the, oh, this is all dire, this is all horrible, there's not enough budgets and everything. We just need to find a way to get people
and it's about showing the nuance of the sector as well. So if we're talking about how do we attract people from outside the sector into social care, it's about showing that nuance, like the way you have crime dramas or legal dramas or medical dramas like Grey's Anatomy, you follow characters and like they are the main character of their storyline. So if they, you know, they mess up or something goes wrong, you don't think, oh, the entire sector is terrible. You go, oh, that person had a bad day or they made a mistake. And there's so much more compassion and empathy that's given to those sectors. But if something goes wrong in social care, it's as if all hell has been let loose. And we are all tarred with the same brush, and I just don't think that's fair. So yeah, but we're trying to focus more about like recruitment, retention, workforce development, not so much so we can talk about that separately.
No, and yes, of course it's really important, but you know it is, we know that there's, I mean, the talk that we had this morning, the first session that we had within the leadership stream was a lady who I met, one of our corporate partners, Premier Community, and she was now the registered manager, but she came from hospitality, and it was her journey going from a carer during COVID to registered manager, and all the transferable skills that she had from the hospitality sector. So there's so many skills from other sectors that are completely transferable, and if anything, you know, I think she's got a real advantage because she's been in customer service where there has been that service level expectation, and she understands how to deal and really react to customers as well, which helps, doesn't it? Because it's difficult from, you know, from my own personal view, from families' perspective, is having those conversations. It's hard for care business, anybody working in care, to have conversations with family members. So, you know, it's giving them that skills to be able to do that as well, because we're tough.
Yeah,
it's tough
absolutely.
to deal with.
It's so easy to think about customer support or client support, however you want to phrase it, is an easy thing that everyone can do. But again, same as any other skill, it requires training. It requires like workshops that you have to hold either internally, or you can ask external people to come in and workshops for you. So like in the context of recruitment, for example, we at RCH, one of the things that we did when we were overhauling our recruitment and retention like processes, systems, etc., is we did a deep dive into what we're already doing and to like really understand what are we doing right, what are we not doing, or like where are the areas of improvement. And so one of those areas was doing mystery shops and like on our own services to see how people respond when they are asked, when people are calling up to inquire about jobs. Were they talking about the benefits of coming to work at RCH? Like, you know, there could be the physical benefits, the tangible benefits, but also the intangible ones, like, you know, you are really improving a resident's quality of life. Or where they're going straight into these are the number of hours you need to work, right? Like it's just about how you frame those introductory conversations. And if you start from focusing more on like the positive aspects, that you can then bring in the logistical stuff later, but you need to, like I said, you need to sell yourself at the beginning. Recruitment is like marketing, but for job seekers rather than for care seekers. So they're very similar processes. It's just a slightly different hat that you need to put on. And then again, like when you're doing like deep dives and audits into like your own processes, I think within the sector, it's very easy to go, oh, recruitment's terrible. We've got a recruitment crisis going on and we need to spend tons of money to overhaul this. Sometimes it's literally just looking at your internal process and going, where have I got areas for improvement as an individual provider? And some of those things, they, like I said, they don't cost any money. It just takes a bit of time and reframing of language or skills. But yeah, going back to like workshops, etc. One of the things that we've done is we host workshops for our teams and we explain to them like the entire careers brand and like the entire careers pathway. And so we go, these are the things that you should be talking about when you are speaking to job seekers, when they're coming in and they are coming in to do interviews and they are like they're applying for roles, etc. Talk about these aspects instead of just it being a given that they already know what they need to talk about. And just, sorry, while we're talking about training, one of the things that like I really strongly believe is that everyone who is a new manager, especially one who's been recently promoted from deputy manager up into a registered manager role, needs to receive financial inductions as part of their induction into a new role. Even if they have been part of that business for the last 10 years and they know the company inside out, right up until deputy manager level, you are focused very much on internal processes and systems. So you are thinking about the clinical, you're thinking about quality of care, etc. that one of the biggest jumps that people have in the sector is from deputy manager up to registered manager, and that switch in thinking from internal clinical to external commercial
strategy.
like
That's
yeah.
Mm.
And so
And
things like
financials, all of those
so like,
skills
do you
that,
understand a basic P&L? And like when I say do you understand, it's you go in with the assumption that people have not received this training and you are going to be the one to give them the training to the standards that you want from the outset. And this is honestly why inductions are so important, regardless of role. Even if you are transferring from a role within the same company and you're just getting promotion, like your promotions should still include inductions of these are the roles and responsibilities that are required as part of your new role. And here's some of the new skills that you are either going to learn or we need you to learn. So I think that jump from deputy to registered manager is one of the ones that as a sector we struggle with the most. Because it's like, do you know who your competitors are? Do you, like, it's not just when I talk about training, it is like, it sounds like common sense when you say it, but it's like, do you know who your competitors are? And I have definitely had instances where we've asked our new managers, who are your competitors? And they'll list off like 5 people in the local, 5 care providers in the locality. And we're like, but that's not a competitor because they don't provide the same service that we do. And so you can't just assume that because someone has been working in your care home for the last, 2 years, 5 years, however long it is, that they know the external landscape.
And then because you're all, well, hopefully what you should be doing as an organization is really understanding who your target people are that you're wanting to attract, and that goes back to really understanding who you're trying to attract as well.
So one thing I would like to add to what Jasmeet mentioned is that don't forget the job description, because there's a lot of preconceptions of people thinking they know what the role is, and they don't actually. They think they know it, they accept a role, and then they actually don't know what they've signed up for. So we constantly review our job descriptions. Also, as we change our business and we refine things, we change processes, we have to revise our job descriptions, because actually some things are now automated, so they don't actually have to do it manually. So it's more reviewing it rather than updating it. So there is a lot of that we have to do, because even with our new managers, we definitely do inductions, but we also make sure that they know what the requirements are, and we highlight what the key points of their role is.
And I'm always, because obviously it would be great if we can continue with the people plan, and what I'd love to do is launch a program that would actually enable care providers to build their own workforce development plan that actually takes them through the whole process, and we will definitely do that in 2025. But it's just, it's got to be, it can't be copied, can it? It's got to be something that's yours, and it's got to be something that you believe in as well. And it's got to be right for your business, because every business is unique. I know you can share best practice and you can share everything, share so much of the systems and processes, and we can say what best practice is, but people have to understand why they need to do that, don't they, as part of that?
Yeah, I fully agree. And I definitely think, because I've come from outside of the sector, I've come at things from a position of first principles. So like, why are you doing X, Y, Z? And whenever you ask teams this, and this is definitely something that is applicable both within RCH and like when we were doing the people plan, is that it's very easy to go because that's the way it's always been done. But that's not truly innovative thinking. And like, maybe there was a really valid reason that it was done that way when you first started doing that process, whether that process was 6 months ago or 10 years ago. But is it still valid today? Is it still useful? And is it still providing benefit to you today? And if not, is there a way to improve it? And I think when it comes to, when we talk about workforce development, we think about retention. And we're like, okay, the difference between what senior leadership team thinks is part of a process and what the front lines know is actually a process, there is a big disconnect there. And so when you are thinking about overhauling or reviewing your internal systems and processes, you need to do them in co-production with your teams. Like, you need to be asking your teams, what is every step that is required of XYZ process, and then go through it and go, is there a way that we can streamline this? Do we need to do all of those steps? Is there a way that we can shift things around so that maybe you do things in a slightly different order? So yeah, it's just
honestly, it's just
like,
amazing.
just ask why you do things.
Yeah, absolutely. Is it, do we really need to do that? What are we actually achieving from this process? because quite often I see a lot of processes that have been developed, and I think, why? As you say, the sort of, you know, the historical process, and I don't know why, I don't know what purpose that's serving, because people have just done it.
I think something that people need to remember is fresh blood is also good. So you know, when you have someone sitting in the role for 4 or 5 years and they do things a certain way, and then everyone's always worrying about retention, but actually people don't see the benefit in certain amount of turnover as well. And that's the thing, when you get a fresh perspective looking at things, it's again a game changer. So I think I'm a bit of an eternal optimist. We can find the positive in any situation, in that even if people leave and they're wrong for the organization, I'd rather they just leave rather than breeding negativity and toxic attitudes. You bring someone fresh in, they'll look at stuff in a different way, they'll bring in their own perspective. And either if they've got the right attitude, they'll just learn to do it the way they're meant to do it, or you'll be surprised and you'll just learn these amazing things from them, because actually you've got that broad mind as an employer that you want. I think just don't micromanage and see what happens. There's certain levels of we need to do things with that because we don't miss it, but then there's a certain level of let people have that discretion of doing it their way and see what happens.
And, you know, you talk about, you know, it does give you a fresh perspective, but it's also, you know, health and social care are absolutely going to change radically, I think, over the next 10 years, because we've got the onset, you know, of AI technology. It is coming. We've got the challenges in the workforce, and it's almost like if we don't get onto that innovative and curious mindset as to what these new developments could actually offer us, then I think that's going to be really difficult for some, you know. So we've got to get into that frame mind that innovation and new ways of working could potentially be fabulous.
Yeah, and innovation doesn't just need to include tech. I think when people hear the word innovation, they go, oh, we need to digitize and we need to do something new with tech. Yes, that is an aspect of innovation, but it's also just thinking about things in a different way. So one of the hills that I will die on is that ways
of working, you know, just
ways of
innovative ways of working.
Yeah, and like one of the hills that I will die on is that I personally believe, and this is not something that's really part of the people plan, but this is like my personal belief, is that as part of mandatory training, we should be training everyone on trauma-informed care and how to recognize and support people who are survivors and victims of domestic abuse. Because at the moment, the stats are 1 in 4 women in the UK will face domestic abuse of some sort in their life. 1 in 6 men will. And they will face it. It might be witness to it. They might experience it themselves. Whatever the case is, like I can give 2 stories off the top of my head at RCH. We had one resident, she was living with dementia. She had quite complex dementia. And son told us that her ex-husband had been physically violent and abusive. And so she has a very high pain threshold, and she doesn't realize when she's in pain because she's just so used to, in his words, getting on with it. And he told us the story of how she'd walked 3 miles on a broken leg because she needed to drop her son off to school, which as an individual story, it's horrific that she went through that. But from a social care perspective, how are we providing care to someone who doesn't remember or doesn't recognize their threshold for pain? So if they happen to fall, they're just going to get up, and like, if that fall is not witnessed, how are you going to make sure that they're not in pain and that they like haven't hurt themselves somehow? We had another resident, and he didn't like to be in a room with male carers because he himself had experienced abuse as a child from a man in his life. And so unless we know these stories, unless we can provide that support, I think like when we think about innovation, this is one of the areas of where we could be truly innovative. And it's not about tech, it's just about how we improve the quality of care that's provided to all of the people who we're providing care to.
Yeah, so important, isn't it? It isn't just about technology, it is about how we're actually going to improve the whole experience, you know, because I think even humans, we are on our own path, aren't we? Because we are changing, and I think it's changed massively, you know, over the last few years. I certainly feel like it has. So how are we adapting to actually suit the needs of people as they grow older as well, certainly during that change? So I'm just going, because I'm very conscious of time. We've got a couple of minutes left. Would anybody like to ask a question of Palvi or Jazz? Anybody got any questions or thoughts or observations?
We covered it all, Jazz. There's nothing more we've got left to teach
I
them.
mean, there's still so much more I feel like Palvi and I could talk about. Like
Yeah.
this is a particular topic that Palvi and I
Yes.
can talk about until the cows come home, because we're both passionate about it, and
Yeah.
we've just like it's not just our experience, it's also all of this experience that we got from doing the consultations and all of the feedback from the sector, where instead of what, like the people plan, it wasn't just creating something from a top-down approach, it was asking people who are receiving care, people who are working in care, people who are advocates for those receiving care, what needs to be done or improved, or like what's already going well.
Yeah, absolutely. Did you want to come in there? Sorry, I can't see your name. You put
Yeah, sorry, it's not come up. I came in last minute, and excuse the background. I'm in the middle of buying a house, so a friend of mine has kindly let me stay here. So I've got all my stuff on rails. Look, he's the right man. But I think, you know, that conversation with you both, that was really, really interesting. And firstly, I'd like to say congratulations on the work that you've both been doing and produced. Secondly, thanks for delivering that and coming here and sharing that with me. I think you guys touched on some really poignant topics for me, which you'll probably see that I put a little thing in the chat there. Yeah, it feels like you're at the forefront of kind of thinking about these innovations, but these innovations to some degree say to me that there's some common sense within these things. And when we talk about a changing landscape, and rightfully so, I think at the beginning of this delivery, someone said, or I don't know if it was you guys, about change, and people do kind of struggle with that. And there'll be many, many variables of why that is. I think the key is to just kind of be open and keep remembering what our agenda is. And if our, you know, that moral compass, our agenda is in the right place, you'd hope, or thereabouts, then why can't we kind of implement and make change and move with things? What I'm seeing a lot of, so I work, sorry, I'll introduce myself. So I'm a team leader in CAMS. So I work with a complex community intensive therapy team. So my team is kind of like where you'd stop at what they call the highest threshold within CAMS, post like a tier 4, which would be inpatient. So the young people that we get, we see like we will see the sharp end of things, and then the, you know, the sort of more anxiety stuff. So, you know, the things that you were saying that we can transfer across care sectors, you know, you guys are more sort of in domicile, all those things, but yeah, it applies to us as well, I would say. Yeah, and I know we're running out of time, but technology is massive, and AI, so and applications. So I've just gone through a whole 215 applications for a band 3 post, and a lot of it just didn't, you know, I saw some skills within there, but I wasn't sure on the genuinity of it. So going back to what you said, Palvi, sometimes, you know, it's a bit more than just looking at what we see on paper, isn't it?
Yeah.
Thank you so much for that. I appreciate
Absolutely.
it.
Yeah,
Absolutely.
no, thank you.
Absolutely. Thank you for coming and chatting with us then. And absolutely amazing. Thank you so much, Palvi and Giles. That was a really great session. I will be picking your brains. I will be coming to you,
No
but so
problem.
you don't have to. I won't be getting you to do lots. I'll try and do it all, you know, but we do definitely.
We love it. We love the IHSCM, and we're always here to
Yeah.
help.
We're huge proponents and advocates of the IHSCM, so we are happy to support.
Well, we are massive advocates of you too as well. So mutual admiration. Okay, I'm going to hand back to John now.
Oh, fabulous. I think we're just kind of waiting for the other rooms to just close down so that we can bring everybody in to just kind of finish off here. I don't know how it's been for you, but I've thoroughly enjoyed it. I feel nourished by it. I feel energized by it. I feel upskilled by it. I feel I've absorbed various experiences and so on. Some good, some not so good, some heartbreaking, actually, in terms of testimonies that we've heard and so on. But I do hope that you've enjoyed it. I hope that you've all got some kind of benefit and nourishment from the full day. I'm so grateful to everybody who has contributed to presentations and roundtables today. Most of you who've done so are members of the Institute of Health and Social Care Management, and I think that is testament to the spirit that we have within this fantastic institute. It's going from strength to strength. We're expecting some big news in the near future in regard strengthening of where we are. But we cannot be what we are without the support and encouragement and commitment of our members. So thank you to everybody. I can see Palvi and Jasmeet are here right now. So particularly you two for this last thing, and Roy and Ed in the other one, and Elaine Mead in her greener and sustainability fireside chat. It's just been delightful. What a lot we've been through. We've had Dr. Amanda Begley, who began us so strongly this morning, talking about innovation and system transformation and so on. And then we went out into our various streams around leadership and operational management and innovation. And it's just been a galaxy of really good stuff. It will take some time to digest. I think we've managed to record all of it. We shall see. In the past, it's usually been down to me, where I've made a mess of certain recordings, and Jade has quite rightly and vigorously chastised me for making a mess of it. But we think, because I've had very little to do with that today, that we've probably got it right. I must pay testament, if I may, to Jade's just outstanding organisation of all that's gone on today. And I must thank her acolyte, partner in crime, call her what you will, Charlotte Joseph as well, who's just been brilliant behind the scenes, getting everybody properly prepped up, making sure that we've got the programme right, getting the timings right, making sure the tech behind the scenes is right. So to Jade and Charlotte, a very, very heartfelt thank you. And to our colleagues as well, Sue and Emma, who've been brilliant with this. And then to everybody who's contributed at all. Enough from me, I think. You've all earned a well-deserved cup of tea or coffee, or who knows, something more powerful. I'll leave that up to you. But all I want to say to everybody is thank you very much indeed. What a lovely day, and how perfectly we've managed to set this up now for the weekend. So thank you, everybody. Go well. Nobody's going to drive home now. That's the nice thing. You can all just kind of get into your gym jams and, lie on the sofa and watch a bit of Bargain Hunt or something like that just to finish off your day. All right. Thank you very much, everybody.
And thank you, John, for an excellent day.
Thank you, Peter.
John.
Thank you, John.
Thank you.
Thanks all. Well done, everybody.
Thank you.
Brilliant. Bye-bye.